right, welcome back. I'm your host, Michael Stamatinos. Welcome to the Advancing Healthcare Innovation Show. And if you're new to us, we're really excited to have you here. We happen to be very, very passionate and close to healthcare innovation and adoption, caring about things like access and leadership and what that means. And if this is your first time tuning in, let me just tell you a little bit about what we're doing here. So we're a healthcare innovation company, and we're focused on bringing stories of innovation within healthcare to life. And our aim is highlighting real people that are in the trenches, that are truly innovating day in and day out within our space, and just giving them the platform to share their stories with the world. We've got an incredibly action-packed rest of the year. We've got new content, new interviews that are coming out. And for those of you that haven't checked out any historical interviews, make sure you hit the subscribe button now and check out some of those old interviews. So I'm very, very delighted to bring today Christopher Neuharth, who's Vice President of Experience and Digital Innovation at Children's Wisconsin. Christopher, welcome to the show.
Thank you for having me.
Hey, so let's dig in before we kind of dive into all the fun things that you're doing. Maybe we can give the audience a little bit of a 30,000-foot view. Your background's really interesting, coming from engineering and how you've kind of landed in digital innovation on the provider side. Would you mind maybe sharing the audience and our community a little bit about you and who you are and where you're going?
Sure thing. Yeah. So I have a non-traditional kind of pathway to healthcare for sure. As you mentioned, I started my career actually as a software developer, and found myself kind of through that pathway always sort of asking the why questions and trying to design around the consumer experience, which led me into a career of product management and user experience on the vendor side, right? Selling software into largely health insurers, but also health systems. And through that work, I always was trying to get that one step closer to like, where is change really impactful? Is it going to be on the health insurer side, or is it really closer to where that patient provider relationship was? And when I had this opportunity about 5 years ago now to join Children's Hospital of Wisconsin, Children's Wisconsin, now we've rebranded, I thought, well, is that really, am I going to work at a health system directly? Am I going to work at a hospital? And I started a team around digital health, and great timing, right? Because we were able to get some of these programs off the ground ahead of the pandemic. And that's kind of led me all the way into this role of, consumer experience, helping our families kind of have more digital innovations that can help their care journey broadly, really is the way I think about it.
So when you think about when you came on to where things are now, can you speak a little bit about what was the process of laying the foundation down? Like, what was the foundation before you had come in, and what was sort of, what did you have to lay down just to be able to build what it is that you're building today, 5+ years later?
Yeah, I think the biggest thing of starting a team like this was thinking about it more from a system kind of enterprise perspective, where like any good academic medical center, you've got lots of research projects going on, you've got lots of pilot projects, lots of great ideas, but trying to get those to scale and to try to get them to all work together. That's, I think, a very consistent theme I've had over my 5 years of pilot projects are fun. We love all these new and innovative technologies, but actually weaving them together into something that makes sense back to the family point of view in our case, has been probably our biggest challenge. So when we started the department, we said, all right, let's start defining, right? Like, what are our goals around this? Because digital and digital innovation can mean hundreds of different things. And we decided to plant our flag around kind of having that outside in perspective and say, like, we're going to represent the family experience and how they access care, how they communicate with the health system, how they continue their care journey and stay more engaged with it. That doesn't mean that we're not kind of also focused on technologies that change the care experience, because it has to go hand in hand. But we said that's how we're going to start identifying these things, because if it doesn't work for the family, it's just not going to work, right, overall.
And how did you find that process? Was it easy to land on a universal definition of what it was that you guys were trying to solve?
No, No, I mean there were so many possible areas, and also like in just doing that, you're trying to define almost a broader technology plan, right? You're trying to say, all right, so bucket these things of like, all right, what's clinical technology, what's business technology, what are these, what are all these wonderful opportunities you might have in terms of AI and automation, machine learning, and just say, all right, we're going to put those in one bucket. We're going to look at one, and it took us years, I think, to say, we're going to try a lot of different things. And we're going to have some tolerance for risk and looking at new technologies. Some worked, some didn't, and I think it's led us towards now something that is a bit more of a cohesive plan. But it took several years, and then a pandemic in the middle of that, right, to kind of force a lot of change as well.
Can you talk a little bit about risk, about how you guys came up with that threshold? Because I think there's a lot of maybe misconceptions that are out there that talk about how there's a lot of innovation happening within healthcare, but point to me those that are really early, that are coming in really early and adopting and trying to adopt at scale. What has been your experience with that?
Yeah, well, I think it's one of the challenging things about working with, bringing technologies into healthcare is we apply the same level of risk that we have around, medical decision making to all decisions, right? And so sometimes it's a matter of kind of looking at these things and saying, okay, how can we mitigate that? How can we look and say, even just how we bring something in, right? Like, and how do we agree upon what is a pilot? How do you get something to scale, right? Like, what needs to be integrated, what doesn't need to be integrated. One thing that we did when creating the department was we essentially set aside some budget that was like I don't want to say like an innovation fund, but we set up the model to say we would live in our area for about 2 years, and it's okay that it would fail sometimes, because after those 2 years, then we'd say we'd cut ties and said we tried that, we're going to move on from that technology. But then a number of things graduated, right? And they would move up to the next level and sort of put it back into the larger operating budget and kind of move to other hospital operators to take on that work. So I think, creating those just the mindset for risk, and also creating some mechanisms to actually be able to take on the risk as well, because it's hard to just throw that into any operational area at a hospital system.
Where did you come up with the 2 year number?
I think we acknowledge that pilots have to be a bit longer term, and it was really a mechanism more of the annual budgeting cycle to say, like,
Okay.
we really have to look at that kind of window. We hoped over like 12 to 18 months that you'd have a good sense of, is this working or not? Is it leading to better provider satisfaction, patient satisfaction, maybe some early kind of outcome metrics and then that was just enough time to say, all right, we're ready to move it to another budget.
Have there been any instances in the past where maybe you've seen, let's just say, positive or not so positive results in a short period of time that made you want to either move quicker to scale across, or maybe cut ties a little bit sooner? Or have you always kept the discipline to, hey, let this roll out for 2 years and let's see where things land?
Yeah, I think we've seen both. There were some projects where, I'll give an example of, like, we looked at like rolling out bidirectional texting with families, right? Like, so, and, think about that from a pediatric population. We generally have a, bit younger population,
Mhm.
not with the kids, but the young parents as well. And that took off really quickly and got to scale across the entire health system because it was just a preferred modality for a lot of people. So we said, all right, we really got to operate this like it's at scale, like it's a digital operations program, and say, like, we're not going to treat it as a pilot. And that happened probably within the course of a year. We've had other projects, certainly if on that first pass, as we start rolling things out, we usually have some sort of survey methodology, right, where we're asking staff um, and our families, like, just what they think of the experience. And if it's adding friction to a workflow and it's just too much to take on, we know pretty early, right? Like, unless we can change that whole design, that this just isn't going to work out at that point.
So then do you think it's more a matter of the initial setup of the experiment of the sprint, even if it is a, you know, a 2 year long sprint, but you're basically just extending that out to say what does success look like? What if things get off track? What happens when things get off track? Like walk me through the process of what happens. What is that internal communication like with the team, but then also with the external innovation that's trying to come in?
Yeah, I think depending on the stage of the company that we're working with, right? If it's a startup, I think it's good to be pretty honest at the outset that we're in here as a partnership, and we're both exploring different business models and different workflows, and it should be a learning experience on both sides. So we've had successful pivots with startups as well. Said, hey, this model is just adding, can you come up with a simpler way of rolling this out, or change there? And I think similarly to like what I look at as like my internal customers, they know we're coming to them with potential solutions. We're not selling that solution to them. We're their partner in trying to find those risks and sort of like bridge both sides, be that sort of matchmaker within the organization. And that means sometimes, like my team has had to play a little more hands-on role. Maybe we're going to help in some support. Maybe we're going to roll our sleeves a little bit more in those cases. But you really have to come eyes wide open on those things. And the other thing I will say that you can do to help mitigate risk is involve the families and the care teams in the design of the pilot early, right? I'm a proponent of like design thinking and design sprint methodology, and like you can do a lot quickly to just get that gut check of like, yeah, I think this is going to be useful for me or not, right at the outset.
Yeah. Do you find that many startups miss that component, or are you an encourager of that thing? Hey, we need to pull all the key stakeholders in to start with. What's that like?
Yeah, I think we've had good experiences with startups. I think it's the only time that kind of breaks down is if somebody's pretty stubborn about their business model and said, no, now we know this is the way, like we know this is successful. And that's what we try to say to them is like, you may have a wonderful idea, but you don't understand the inner machinations of like a health system and how complex it is. So we're not here to try to change your idea and concept but we're trying to just make it work in that broader ecosystem. And I think everybody gets sort of proud of their product and wants to make like an example make of this is everybody wants an app, right? Everybody wants to make an app for their digital health product. And what we try to coach them on is like it takes a long time to make a consumer brand. If you're going to tackle it from that aspect, your runway might be longer than your funding, frankly. And you've got a lot of really successful brands out there that you can partner with and get and be under their umbrella and be more of like Intel inside behind the scenes rather than trying to like create your own product.
Do you find that consumers now and families are over apped? There's just too many applications. There's too much confusion.
Way
Are
too
you
many. I
saying
mean, there's tens,
simplification?
yeah, tens of thousands of consumer wellness apps and healthcare apps, and just looking in the pediatric space, the amount of mental health apps that are marketed to families, it's overwhelming. Even from our own perspective, when I joined, we had handful of different apps that we told families to download. So, all right, you've got a symptom checker app. You've got another app for your video visits with our urgent care. You've got an app for when you're in the hospital. That's way too complex, right? But even at that level, we said you should have one, just like you have one Starbucks app. You don't have a bunch of them. You should have one app for your hospital system,
Yeah,
which
so is it
means
just one Children's Wisconsin app, and then
it is
there's
now.
other stuff? It is now.
Yeah, yeah. So we had to kind of bring some of that together as well, and that's challenging because we want to take advantage of all these wonderful innovations and give them, but there has to be somewhat of a central hub as we communicate with families as well.
Do you find that's a standard? Is now just meet meet the provider where they are on their journey, and as you're trying to establish your brand, making sure that you're amplifying that brand. So maybe like you mentioned, it's you're the behind the scenes external innovation driving some of these processes, but you're not necessarily being recognized as the prominent brand as I think they ought not to be, because it's coming from that trusted source. People trust the name of Children's Wisconsin, and that's taken years and
Right.
years and years to get to that point. Has there ever been an instance where things have gone dramatically wrong without naming names? What have been some of the biggest key learnings within sort of your short time period there? I think 5 years is short time in comparison to other long stretches, but what have been some of those learnings on some of the misfires?
Yeah, I think there are what I won't name names obviously, but there are certain solutions that I think are too narrow in their focus. They may be fantastic at one thing, whether it's medication adherence or, a care pathway, whatever it might be, but they don't take into account that that's all part of a broader journey for somebody, right? And so to say, all right, you've got this application for this and this solution for that, you really have to put it all in context and think about how you're going to create true engagement with somebody. And those are the areas where, like I said, it's wonderful ideas, right? Right? It's like, if it, and all these business cases are sort of built on, if they did this all the time, it would lead to these sort of outcomes. I'm like, well, that's a big if, right? And so you have to get to, what's going to lead to that outcome and how you're going to create that engagement.
Let's talk about, we spoke about this earlier, getting the buy-in from various stakeholders. There's a lot of energy expenditure, and you mentioned that oftentimes you and your team are bridge builders. You're connecting, you're putting pieces together. How can an external innovation create less friction in that process? What can they do to support you and your team within that process?
Yeah, I think a little bit of just understanding of our perspective that we're, like a team like mine is there to help them support that, bring them in. And so in order to do that, they have to have considered kind of all of these potential outcome metrics. And sometimes startups that we work with, they jump ahead a couple levels and they get to like, well, here we're going to change, the trajectory of healthcare long term or so. Instead of sort of backing up and say, all right, how are you going to prove this, like have a multi-phase sort of approach? How are you going to prove the success of the pilot? And be honest, right? Don't try to get to something that's too aggressive. Say, you know what, we want to lead to, better provider satisfaction, better patient satisfaction, and we have some process metrics. Great. And then what's the stage gate for that? What are we going to get to that next level? And kind of build on it from there, because but you have to also have that eye towards, okay, well, if you're sitting in that chair of, someone operating a call center or somebody responsible for a cardiology unit, like whatever it might be, like, okay, how are they going to be seen as the hero in their role too? And so how do you get them to kind of the metrics that will really matter in that perspective?
So it sounds like what you're saying is have the simple formula from X to Y by when, be simple, be clear, be precise, and then also leave some room in there to think bigger picture beyond. And with a what I'll say is with a healthy level of healthy expectations.
Exactly. Yeah. I think like, there are so many of these things that would need multi-year studies, right, to really prove these outcomes. But I think we can all like look at like kind of what they're doing and say, can we trust the methodology enough that we feel confident? Yes, you're hitting the right target areas, right? And we can look at sort of process measures, interim kind of things to say this is a successful pilot or not, because there's so many, vendors that we talk to that they have big dreams and they're talking about being the ecosystem for everything, and that's great, but we can't sell that, right? We've got to kind of look at kind of what are those steps towards that.
How do your prioritization shift from year to year? You mentioned that it's really about putting the family and the patient at the center. Within that, there's obviously other threads. You talked about patient journey and things of that nature. Does that shift, or is that always true north? And what other things have kind of really come into, from an innovation standpoint, priorities that you kind of then have to tackle and try to solve? Maybe not necessarily technologically, but maybe from a human-centered design standpoint. What else has come to has bubbled to the top of the surface these last several months.
Yeah, I think, certainly if I look at the evolution of our focus, right, our initial focus was around these things like remote care and telemedicine that grew to scale very quickly. We shifted a lot of our attention to just making it easier to access healthcare and make it easier to communicate with the health system. I think the big challenge that every health system is encountering now is the cost of labor and labor supply, and just what does that mean for all of these efforts, because it's hard to bring in anything that would add to the burden of a care team at this point. And but more importantly, I think we also have to look at solutions to say how can we automate, how can we create more workforce joy and fulfillment, and that's been a major area of focus now for me and many of my peers that I talk to.
And any little wins worth sharing?
Well, I think we certainly have a lot of what that we do, in terms of like just patient outreach and communication like reduces the amount of time that we need to serve. I think we're also looking at like how do we make it simpler to prescribe, as we call it, prescribe digital care and solutions, and so how do we create more of a platform approach to that? And so we introduced a platform to do that, so there's just like one place for the care teams to go. So I think we're also like, looking at all of our internal tools, right? How you gather data, how you screen, how you even our intranet, right? All these things to say, how do you reduce the noise for your staff, because there's so much that they're trying to do. And when you look at some of these studies of like what it would take to like actually perform quality care at some patient panels, it's like 27 hours of the day, right? And so you have to really bring down that burden, overall. So I would say there's so many different irons in the fire there, but it's definitely, we can't start a project without thinking about, is this adding to the burden or not?
Has there been anything thus far this year that you guys have done that has brought more joy to the staff? Because the workforce has been something that we continue to hear, probably will for a little while now. Has there been anything that has removed things aside from what you mentioned? Anything else that you're like, wow, I think we're doing this, and this is really ahead. This is really ahead of the curve, and this is next level.
Yeah, I think we've done a lot in terms of trying to make our families self-serve more. So we launched our own consumer app, and so our like online scheduling numbers and our online checking numbers have gone up considerably, which just really reduces that burden. We don't have enough people manning phones and staffing front desks to do that. So that's really reduced some burden there, and we're trying to look at that overall. And then, like I mentioned before, that just that ability to really centralize information and automate in some cases. Like we've got asthma care materials as an example, that we have to get out to everybody with certain markers in their medical record, and we're able to bundle that and deliver it to somebody's smartphone in a way that really saves the care team quite a bit of time as well.
Is all that information fed back into the EMR?
It is, yeah. So we can see if you've reviewed it, if you've watched the video, right, things like that. And then hopefully next time you follow up and say, hey, let's check on those inhalers again. Looks like you've watched that. Looks like you've engaged at home, because that's so much of this, especially with a chronic condition like asthma. It's just, can you stay consistent with the management?
I'd be remiss if I wouldn't bring up ChatGPT in this conversation. There's been a lot of talk around ChatGPT. Where are you in that camp? I feel like it's very polarizing. Just sort of
Yeah,
curious to where you stand on that.
I think that there is a huge need for educating health systems on the various kind of aspects of like breaking down what is AI, right? In ChatGPT's case, like what is generative AI? I think there's a big discomfort, right? We've looked at some of these technologies and said it looks awesome. If I ask that same technology just give me its source material, it can't, right? In a lot of cases. And that in a healthcare environment is pretty concerning, right? If you're going to scrape through my website as an example and tell me all right, well, here's what you should be doing for this condition. And you've pieced together various parts of that. That's concerning, right? Because combining a few pieces of information can be pretty dangerous in a healthcare setting. And so sources and research are sort of the cornerstone of what we're looking at. So I think there are certain like administrative type of things that it has a lot of potential for, but we have to be really well educated and careful with it.
I hear that a lot. I hear, hey, interesting, and let's proceed with caution. Let's set up some rules and some guidelines. Let's have some governance, and let's not just, this isn't the wild, wild west. There's a level of sensitivity here that I think we need to pay attention to that. So absolutely. How else can people follow your work? Give us a plug about Children's Wisconsin. Where can people follow some of the great things and some of the awesome patient stories that you guys are showcasing and sharing? How do they keep tabs with what you guys are doing?
Yeah, I mean, it definitely we do a lot through our own website and kind of push out through social media and LinkedIn, and then certainly follow me on LinkedIn as well, and keep up to date with what we're doing. We try to share in every environment we can, because I think that for me that's one of the beauties of working in healthcare is that we're all trying to make each other better too. Um, there's so much open sharing of information that I never experience in other industries. So appreciate that.
Are there pediatric specific collaboratives? I know we spoke about this a little bit, but I'm just sort of curious, is there really a focused network of other digital innovators that are pediatric specific that you kind of get together with on a regular basis?
Yeah, we have a couple. So we're a part of the Avia network, and there's a number of children's hospitals in that we get together in similar roles. And then KidsX is a big pediatric accelerator out of Children's LA, and that's a great venue to just really help boost a lot of these pediatric startups because more of the money in digital health has been traditionally in the kind of the aging population. So
Mm,
we're trying to represent the kids and get that all those startups as much energy as they need.
great. Well, any last comments before we kind of sign off here? If for those that are tuning in, if there's like a one tip, one golden nugget that you can give to a startup that's doing their best to try to really gain access into a children's hospital, what would you suggest is sort of the ideal course of action? We know there isn't a silver bullet, but if there was one methodology that you find to be more purposeful, and let us
Yeah,
know.
I think this will be, kind of a seem kind of targeted, but I will say, don't start as a data product, right? Think about yourself and as like, how do you power these brands and leverage these brands to be successful and fit within their ecosystem? Don't be stubborn about trying to be that next killer app. I think you have a much quicker path to success potentially that way.
Awesome, Christopher. This has been incredibly helpful. And for those that are tuning in, we thank our community. And if you found this content helpful for you, would you mind sharing it on social media? Even just commenting, sharing, liking, it goes a long way. We're grateful for everyone that's been involved in the Advancing Health Innovation Consortium community. We try to bring some of these conversations that are very real, very forward thinking, and innovation doesn't necessarily have to be curing cancer. It can be something that is a process improvement, and you've shared some pretty good golden nuggets today, Christopher. So I'm appreciative of that and look forward to having you come onto the show in the future at some point.
Great. Thanks for having me.
All the best.